Thank you, Chair, and welcome, Dr. Houston. Dr. Houston, how many foreign doctors did the University of Toronto train last year through the visa trainee program?
So last year, in total, we had 459 physicians in this program,
Trainee program.
in
Okay.
the residency program
Thank you.
and the fellowship program. So total residency and fellowship.
How many returned to their home country after training?
They are all expected to return to their home country. It is part of the contract that we have with their sponsor that the trainee also signs on to.
How many visa trainees completed their training at the University of Toronto last year?
I don't have that exact number, but I can provide it to you because they they range from PGY 1s to PGY 7s. We accept between 2 and 4 residents into family medicine, and they return after 2 years. Those in the Royal College specialty and subspecialties train for a variable number of years, depending on the residency program.
So would, like, you have a rough idea, like 1,000, 500?
Oh, no, not that large. So if we have 459 in the program, the maximum we could send out in any given year would be 459.
Okay, if you could forward that information, that'd be
I will
great.
certainly give you the information as to how many graduated last year.
Okay, and then how many Canadian medical students graduated from the University of Toronto last year?
So the current cohort is 303 students that came in, and last year I believe we graduated 259 students. And the reason for the discrepancy is that we have expanded our medical school numbers, our cohort, in the last years due to
Okay.
increased funding.
Yep, I got my number. Thank you so much. How much does a single Saudi-sponsored visa trainee pay to the University of Toronto per year of training?
The trainee does not pay the University of Toronto any dollars. The sponsor pays us $100,000. They also provide the salary and the cost of living for accommodations for the trainee.
So the sponsor would be the Saudi Arabian government?
It's either the government or there are individual institutions in Saudi Arabia or the other 5 Middle Eastern countries that send these funded trainees.
And how, you have any idea how much the total amount is?
The total amount that comes into the University of Toronto? Well, our usual number is between 450 and 500 trainees per year. So if you do the math, that's between $45 and $50 million.
Wow.
It is a significant amount of money that provides funding for our education and research programs.
So $100,000 per student and
Per year.
per year, and then what was those numbers again? 400?
We would have, as I told you, so last year we had 459, and we usually have between 450 and 500 of these learners.
Does the money that the University of Toronto collects from foreign-funded visa trainees go into the faculty's general revenue? Yes or no?
Yes and no. I'm
Okay.
happy to expand on that.
Yep.
So the money first comes into the postgraduate medical education office.
How much?
All of the money.
Percentage?
All of the money initially comes into the postgraduate medical education program. We then determine how much money is needed to support the education programs, both centrally in the postgraduate medical education office and across the medical education program centrally.
so
and
those-
then we distribute the money to the departments, and subsequent to that, we send whatever money is still remaining to the dean's office for use to support other education and research activities.
So it goes into general revenue first, and then you decide where it's going to go,
It comes to the
after that.
postgraduate medical education office first.
which is considered general revenue.
For the postgraduate medical education office.
Okay, and you can table all that information?
I am happy to provide you with that information.
Okay. Is there anything requiring the University of Toronto to use foreign visa trainee funding to expand medical training for Canadians?
No,
No?
no, no. The funding for the expansion of programs for Canadians is provided from the Ministry of Health. Or MCures.
I
It
guess
doesn't go directly to the expansion of the programs. It supports all of the programs.
So it goes
The
into
existing-
general revenues, and you decide where it goes, and it doesn't go back into funding program?
It supports
One
all of
minute?
the programs, not just specifically the expansion programs.
So
It is also used, so
it
I'll
could
give
go-
you an example. It is also used to support our Office of Learner
But
Affairs.
who would, like, it could go into artwork for the walls. Like, it could go into anything into the university.
We take responsibility for the use of the funds, and I would be happy to provide you with what the
Yes, that would
expenses
be
are
very good.
within
could-
education.
If you could table with the committee what fund visa trainee revenues
30
and where they're
seconds.
deposited, that'd be great. How much money in total did the University of Toronto receive last year from foreign governments to train visa trainee doctors?
Amount of dollars that I just explained to you, the $45 million approximately for the 459 trainees we had last year.
Before accepting the money from foreign governments, do you evaluate that country's human rights record?
We do not. In the postgraduate medical education office, that is not our role.
Thank you. I think your time is up.
Thank you, Chair.
Dr. Houston, do you know how much money came to postgraduate medical education at the University of Toronto, specifically from Saudi Arabian sources last year?
Well, if we say that Saudi Arabia represents approximately 40% of the learners, and we got $45 million, then I would say it would be $18 million.
Well done. Fast math. Thank you. Does the University of Toronto receive, and particularly the Temerity School of Medicine, receive other sources of funding from Saudi Arabia other than that, like, let's say in terms of donations or other partnership, let's say not directly associated with the visa trainees?
Not to the best of my knowledge.
Okay. You mentioned this episode in 2018. I was on a medical faculty at that time. I remember it very well. Just to say it into the record again, Chrystia Freeland was then the Foreign Affairs Minister. She criticized the Saudi government. They were putting women in prison because they had the temerity to advocate for their right to drive. And from my recollections, medical faculties lobbied the Foreign Global Affairs Canada and Chrystia Freeland, who happens to be the Member of Parliament, I believe, for most of the University of Toronto Medical School, to temper her criticism, let's say. Are you aware that officials at the University of Toronto lobbied Global Affairs Canada or the Minister of Foreign Affairs to temper her criticism of Saudi Arabia in order to protect this funding?
I am not aware of that occurring.
Okay. We've spoken a lot about the difference between, let's say, funding and capacity. It seems to me pretty obvious that if the University of Toronto currently has the capacity to train Saudis, but the funding is coming from Saudi Arabia, if some other source were to provide that funding and Saudi Arabians were, or the government of Saudi Arabia was not given those residency spots, like if that funding was restored from some other source, the University of Toronto could, for instance, train Canadian IMGs who want to come back home?
We have the capacity at this time and have put forward to the provincial government a further expansion plan for our residency program. So the short answer is yes, we could further expand the
Okay,
number
and-
of residents that we graduate in any given year.
And then an association who represents these Canadian graduates from Ireland, or Irish, Australian, UK, American, Caribbean schools said that often these folks will drum up their own funding, but this funding is not accepted by faculties of medicine. Does your faculty have a policy about this? So if I have an Irish medical degree and my hometown of St. Thomas, Ontario says they will fund my residency, would you accept those funds the way you accept funds from the Kingdom of Saudi Arabia?
That is not allowed by the provincial government. The provincial government, for both the MD program and the postgraduate medical education programs, sets the total number of domestic spots available.
I see. The Kingdom of Saudi Arabia is a brutally repressive dictatorship. So shortly after this episode in 2018, they lured a Washington Post journalist into their Turkish consulate. They dismembered him with a bone saw. This repression continues to this day. They executed somebody for tweets critical of the government this past summer. Do you have any concern that the Temerity medical faculty is compromised by receiving money from this sort of source? Do you think that the faculty, for instance, is able to condemn these practices in Saudi Arabia, or would that risk their funding?
It is not my role. I do not take a role in the political arena. I do take a role in ensuring that we support the education of these trainees that come to us.
Okay, I'm going to interrupt you for a second there. So the Temerity Faculty of Medicine does not have a view as to whether women should be allowed to drive?
say that that may be off the topic about their view on whether women should be allowed to drive.
Well, I think it's
So
directly on
go
topic.
ahead. You have 1 minute left.
The Temerity Faculty of Medicine would not put forward a view on that.
Okay. So Women's College Hospital is part of the Temerity Faculty of Medicine. Like, it doesn't view itself as a feminist institution that promotes equal rights for women both in Canada and abroad.
Women's College is one of the Tasman hospitals.
And it doesn't take a view about women's rights globally.
I have not recently reviewed any of their whatever they have put out about
Okay,
this.
I have one last question. We received an email from a member of the University of Toronto Medical
16
Faculty
seconds.
who wishes to remain anonymous because of fear of reprisals from the administration. He says the impression of rank-and-file faculty is that the Saudi money is used to prop up the growing administrative structure and roles at the faculty rather than improving the training quality and experience of Canadian learners. Is there a reason you can think of why he would want to remain anonymous for fear of reprisal?
The shortest answer possible.
I cannot.
Dr. Houston, through the chair, the University of Toronto's mission statement reads, quote, "The University of Toronto is dedicated to fostering an academic community in which the learning and scholarship of every member may flourish, with vigilant protection for individual human rights and a resolute commitment to the principles of equal opportunity, equity, and justice." Do you think the Kingdom of Saudi Arabia shares these values?
Comment on that.
I'm sorry?
I haven't looked at the mission statement of the Kingdom of Saudi Arabia.
No, that's your university mission statement.
I
that just read.
understand that.
Yeah.
And I'm very supportive of our mission statement.
Okay.
And our mission, as part of our mission, we work with multiple partners around the globe.
Okay. Will you condemn the human rights abuses committed by the countries you've received funding from? Yes or no?
I choose not to respond.
All right. I will take that answer. Do you personally...
I don't see that that is something that I need to answer to.
I want you to know that you've really given us great answers. We've had a whole bunch of witnesses, and I really appreciate the information you've been giving us. What I am trying to determine is, if a Saudi Arabian person can take that spot, what does it take for us to get an IMG in that same spot? Is it $100,000?
No, it's provincial funding.
I realize that. I realize that. But
So it's
when
not
we
the
see this budget,
$100,000?
when we see this budget that has just been set out, how many extra spots are we going to create across Canada? And I'm thinking, well, 97 million could possibly create 1,000 more medical special graduates if we use the money correctly. So some of my questions are trying to get to that answer. Are we using this money correctly? And I'll ask you this question. You'd mentioned that you have all these spots. Now, I'm going to call the Saudi ones extras, and we're going to call the ones that you currently have medical students for as domestic spots.
Correct. So I call them domestic and supernumerary.
How can we increase those domestic spots? What type of dollar figure do we need to have? And I understand you want it to be provincial, but if you could just indicate to me a dollar figure per year per student for a resident on a 5-year program, not family medicine, a specialist. Is it 100,000? Is it 50,000? Is there a number?
Yes, there is a number. So let's start with medical school, because you can't have a resident unless you put a student through medical school. So it costs approximately $80,000 a year to put a medical student through the MD program per year, one student, 1 year, at the University of Toronto. And the reason why the tuition for the postgraduate medical education programs is $100,000 for the Middle Eastern countries is because that's approximately the cost to support that residency position.
Thank you. Now, other universities that I have spoken with have received donations. You'd indicated that the University of Toronto has not received any donations towards any expansions or anything from the Saudi government, just $100,000 per student. There's been no extra kindness.
I said to the best of my knowledge, I was not aware of any other donations from the Saudis to the Temerity Faculty of Medicine. And these are not donations, this is tuition that they pay.
Thank you. These IMGs that we have in Ireland, I feel really bad for. Now, I'm from Alberta. We've got 44 students that want to come back to Alberta and do the CARMS match. They're not having any success. They're finding difficulty. The Alberta government is now looking at creating spaces, and I guess they will associate a number to increase those IMGs. What would it take for
47 seconds?
your university to increase spots?
Would take first the province saying that they would support the expansion, and then the funding from the province for those spots.
Thank you.
30 seconds?
Do you have any concerns about the Canadian university's dependence on the visa trainees from Saudi Arabia, a theocratic monarchy alleged to have committed human rights violations, including state-sanctioned murders, oppression of women, minorities, and curbing freedoms daily?
The University of
seconds.
Toronto trains those physicians to take the values of the Canadian healthcare system and our university back to improve their healthcare system.
Thank you, Chair. Through the Chair. My first questions are for Dr. Irwin. Thank you for coming in today. Really informative and also disturbing in a lot of ways. So, Dr. Irwin, the pediatric unit at the Kelowna Hospital in my region was forced to close for several months amid a doctor shortage. While it has since reopened, I don't believe it's open to full capacity at this point. I'd like to ask, how common is it for a pediatric health care to be suddenly unavailable to a community the size of Kelowna, over 200,000 or nearly 200,000, I think it is now, but also it services the entire interior of BC, basically. It does for pediatrics. How common is that?
I think probably like many specialties, in pediatrics the numbers are often fewer than they would be to serve a similar size population of adult caregivers or adult specialists. And I don't know the exact numbers in your writing, but I would suspect that the total number of physicians available at that hospital to provide pediatric services may have been under some strain, and perhaps it got to a critical number where there were not enough doctors to provide possibly safe health care. I don't know the
is that
details.
common? Is that a common thing to happen throughout the country?
I think it can be. I can give you some examples from Ontario or from some of the groups that I'm more aware of. I'll give you a very different example. I'm a pediatric oncologist, so I care for children with cancer.
Thank you.
We in Toronto provide bone marrow transplants for children essentially east of Ottawa, from Ottawa and eastward. We only have 5 physicians, and that took a lot of work to recruit them to provide bone marrow transplants.
So it's
if
just
any of those
shortage.
physicians leave, we will not be able to do what we can do. And if more than 2 left, we may have to. We would potentially have to close the program.
And have you closed then?
We have not needed
Okay.
to, but 4
You're
out of
close.
those 5 are internationally trained physicians. We were not able to identify Canadians.
So what risks in care are possible to our children if a hospital lacks a pediatric unit? So
Right.
if someone says to me, oh, well, they'll just go to another unit. Tell me what the risks are.
That's a really important question. As I alluded to, we are not the same. We train very differently in pediatrics. We do 4 years of training after medical school graduation in pediatrics, and then our subspecialties. So in oncology, that's another 3 years of hematology and oncology. We take care of different conditions, whether that be in kidney, heart,
Okay.
et cetera. And so
So it's a
physicians
very
would not have
dangerous
the same
situation.
expertise.
So
Exactly.
do you predict that at some point there's going to be pediatric units closing permanently? And would you say that we may come up with an excuse, or administration might come up with an excuse like, well, it'll be covered in other areas, but of course you don't believe that, and it doesn't sound like it's possible.
I do not believe that would be safe and high-quality care for our children.
But you see that coming down the road.
I see it
like.
being a risk, especially when we have a strained workforce. There are some so again, there's multiple specialties. There's general pediatrics, which is probably a big part of the population you're speaking about, but there's also many specialties under strain. We know that cardiologists who take care of our youngest children, pediatric cardiologists, more than half of our current practicing across the country are over 50, and over 20% are over 60.
Okay.
So that tells
So
you
it's a-
something about
yeah,
that workforce.
It's a very dangerous situation. Is pediatric medicine that's taught in schools in Australia, America, or the United Kingdom, let's say, is it comparable to medicine that's taught in Canadian medical schools, and so would be interchangeable in that we could receive doctors from those countries, and they should be able to fit right in with our pediatric requirements?
I believe so. Dr. McPherson spoke about that. I
Yes.
am also, you may have seen in my biography, I am a Harvard-trained physician. I did my medical school at Harvard. I did my residency at Boston Children's and
Yes.
Dana-Farber.
Okay, then it's very,
I believe it is incredibly similar, and we have standards that we follow, and
of course you do, and
I
I'm
think
sure.
yeah.
Thank you so much.
Sure. Thank you.
Dr. McPherson, it sounds as if, thank you for your opening statements. You said Canada licensing is burdensome, disorganized, and inconsistent. That's pretty clear what you feel about it and what we've been hearing from other witnesses. It sounds to me like Americans want to leave, want to work here. But would you say that Canada is getting a bad reputation in the United States or throughout the world, possibly? That after a while, we're going to get less and less people actually wanting to even try to make the leap to come to Canada, which we need so badly. We need those doctors so badly.
I wouldn't go so far as to say that Canada is getting a bad reputation. I think everyone understands that bureaucracy comes with paperwork and you know.
But you said Canada has a lot more than you.
32 seconds.
But there certainly is frustration with the process, and there's a very large online community of U.S. physicians that explore the options
Okay.
of practicing abroad.
One
and
more quick question. Sorry,
Yeah.
we only have a few seconds. Sorry to interrupt you. So British Columbia instituted a campaign to try to recruit more U.S. physicians, but do you know any of your colleagues who are looking to move to British Columbia? Is that working? And because you originally were going to move there, right? And is it working, do you feel?
Yeah, I actually have a
2
couple of colleagues who have moved to British Columbia
And
this
are they
year.
actually working? Yeah,
Thank
okay,
you.
great
The
to hear.
time is up.
Thank you.
Thank you.
Thank you, Chair. Through the chair, Dr. Irwin, how many pediatric spots are there across Canada? It's under 10, is it?
So that's part of our initiative where we collected the data. So if we look at provincially funded, so publicly
Yes,
funded spots,
domestic.
on average, there's around 65 a year for the subspecialties, and a larger number, I think I'll have to get you the exact number, but it's at least double that number for general pediatrics. So first you must do general pediatrics for 4 years, and then the subspecialties. So that 65 is for that latter part of training.
Okay. Now, I'm going to ask this about the special extra
Yep.
spots. Do you know how many, and just speak to Ontario, do you know how many extra spots there are for pediatrics in that extra group through the University of Toronto?
So you're talking about the visa specifically?
Right on, yeah.
Yeah, so I do know for general pediatrics.
Yeah.
For general pediatrics, we have about 4.
4.
And it, again, does not take away from the other 20 to 25.
I get
a
that.
year.
Now, of those 4, have you ever had a female from
Yes.
Saudi Arabia?
Yes.
You have?
Yes.
And how did you deal with the language barrier? Did that work itself out?
So all of our trainees, not just the visa trainees, all of our trainees who are not Canadian medical graduates take part in I'll call it a probationary type of process we have for the first several months. And they are not only judged on their medical competency, but also their language
Okay.
competency
Thank you
as
so
part
much.
of that.
I'd like to share my time, Madam Chair, with Dan Mazer. Thank you.
Mr. Mazer, you have 3 minutes and 12 seconds.
Thank you, Chair, and I'd like to move the following motion. Given that the Chair abruptly suspended the meeting before completing 1 hour of testimony as agreed by the committee summons Dr. Patricia Houston, Vice Dean of Medical Education at University of Toronto, to appear within 1 week of this motion for 1 hour of testimony as part of the study on the impact of immigration policy in healthcare.
Now, there's a motion on the floor. Ms. Sidhu?
Madam Chair, I just want to let everyone know there's a technical difficulty, like 2 or 3 times happened. It's not anybody's fault. It was technical difficulty. And then second panel was waiting for that. Everyone has a question for the second panel. It's not anybody's fault. It's technical difficulty.
Thank you. I've got Ms. Conant.
Yes, I support this motion, and I would like it to go to a vote. I know for myself, I especially did not get to ask her any questions, the representative from the University of Toronto, and I felt that all of us here were really being educated about the programs that U of T offers, in particular for Saudi Arabian students. And I think we were getting to the core of what might be an issue in our medical system here, where we're excluding Canadians and bringing on people from other countries who are not staying here to work. And I don't know about everyone else around this table, but the people in my riding, in my area, are desperate for these doctors. We can't have people come and train here and then leave the country. If there's room for somebody to be here and train, then there must be room for a Canadian or somebody from another country to train here and then stay here. So they're taking up a space. I'd like to hear more about it, and so I support this motion.
Mr. Strauss? To the motion, please.
Thank you, Chair. It's a really important issue. The motion that we previously agreed to was that we would do 1 hour of questions with her. We debated that motion at length. From my point of view, there already procedurally is a motion to that effect. We only got 50 minutes with her. I think the next time she appears, it could be by Zoom. There's no reason that it needs to put her out and fly her back up to Ottawa. But ultimately, this committee's already agreed. We had 1 hour of questioning with her. We didn't get it because of technical difficulties. But we did have resources to continue. So,
just to clarify, we were 11 minutes short in that hour. So perhaps you would like her to come for 11 minutes?
I think if she is going to the hassle of reappearing, then 11 minutes seems not.
You just suggested a Zoom meeting.
Sure, I think that would be reasonable, depending on her schedule. But she was giving very interesting answers. I think it's a fundamental issue with our medical education system if we're training up to 20% of doctors at these institutions to not serve Canadians using Canadian public resources. So yeah, I support the motion. Thanks.
Thank you, Mr. Strauss.
Can we suspend for a moment, please?
Would you like to suspend, Ms. Chi?
Thank you.
We suspend. Let it be known that as a courtesy, I'm allowing the Conservative member to have 5 minutes with the witnesses. Mr. Strauss.
Thank you, Chair. So my questions today are for Dr. McPherson. Dr. McPherson, thank you so much for coming today. It means a lot on behalf of the people of Kitchener. Thank you for coming to serve our community. And beyond that, thank you for coming to committee today, because you're not just serving Kitchener now, you're serving the whole country of Canada. So we're really pleased and proud to have you here. I'd like to ask some questions at a high degree of granularity, because I think individual cases help us to understand what is actually going on with immigration for healthcare professionals. If I ask you any questions that are prying or you don't feel comfortable answering, just please let me know. I don't feel compelled to answer anything. We spoke a little bit before the meeting. By your lights, now you've practiced in both countries. You've practiced all around the United States, as you told me. Is there any reason ER doctors in general in the United States wouldn't be able to practice in Canada tomorrow?
Not that I'm aware of. I haven't found any really significant differences in the practice patterns that would prevent an American physician from practicing in Canada.
Fantastic. And overall, when you decided to come to Ontario, what barriers in terms of getting your license recognized did you meet?
I actually found the CPSO process for licensing to be fairly straightforward, just quite long, but I would say that compared to kind of the confusing process of British Columbia, Ontario's CPSO compares favorably.
I'm pleased to hear that. When you say long, how long do you mean?
It took me a few months to get the documents together. A lot of that includes getting official copies of transcripts from medical schools, which have to be mailed directly to the CPSO, and those are sort of the rate limiting steps. If you are really dedicated, you can get it done within 2 or 3 months.
I see. So, I mean, I would say, I won't ask your opinion on this, but I would say I think that if you hold a license in Oregon, it's probably the case that you passed all your med school courses. And it's a little bit strange to me that they would insist on verifying those documents in particular. You spoke a little bit about the provincial nominee program and how that was giving you a hard time because of some terminology that I think pretty obviously needs to be changed. But may I ask, which immigration program are you currently here on and working under?
So I'm currently here on a temporary work permit, which will expire after 3 years.
I see. And then beyond the provincial nominee program that you're speaking about, are there any other federal immigration programs that you have evaluated or considered or engaged that could take you on the path to permanent residency?
I'm not aware of any other pathway that would be viable for me. I am trying to improve my French to get some additional points for my application.
Tell me a little bit more about that. How would improving your French improve your ability to buy a home in Kitchener, Ontario?
So if I can demonstrate a certain level of French, then I can potentially apply for express entry as a French-speaking skilled worker, which is an alternative pathway.
I see. And so if you were to be evaluated and meet criteria to be a French-speaking skilled worker, you would have an easier time achieving permanent residency to work in Kitchener, Ontario as a emergency room physician?
Yeah, I mean, essentially it's a completely different pathway, which I don't think has any specific bearing on being a physician. It's really just any skilled professional who is fluent in French can qualify for an alternative pathway to express entry.
All right.
1 minute.
I'm honestly a bit flabbergasted by this. Could you tell me which languages other than English you encounter in the emergency room in Kitchener, Ontario, say by frequency?
I think quite a few of my patients are Indian, and so speaking various language from India. I've had quite a few patients who speak Mandarin, Arabic. I don't think I've had any patients who speak French and do not speak English.
I see. It seems to me, I won't ask you to speak to this as you're going through the immigration process, but it seems to me that this could be rationalized in part. And then, so could you speak a little bit about if you continue to have difficulty achieving permanent residence status, either through the PNP program or any other program, what hardships does this cause you? Does it put you at risk of going back?
I mean, the short-term issue is that there's a 25% foreign investor tax on purchasing a home. So I'm living in a rental house with my husband and children, which is not a position I've been in quite some time. It's not ideal. We would love
Thank
to
you.
be
We've
able-
gone 21 seconds over time, Mr. Strauss.
Thank you very much.
Thank you. I wish to thank the witnesses for being here, and I wish to thank them for giving their time and their expertise to the answers. I also want to thank the committee for being generous enough to give the Conservatives an extra 5 minutes time for questioning because no one else got that. So thank you for that courtesy. And I now adjourn the meeting.
Chair?
Yes, Mr. New?
I just moved to adjourn the meeting.
Yes, meeting's adjourned.
Chair, I object.